The Advancing Behavioral Health Initiative directly relates to the HW Endowment's mission by building partnerships across the state of Wisconsin that engage to improve health of all the communities of Wisconsin.
I got really excited when I heard about the Advancing a Healthier Wisconsin project for behavioral health. It was an extremely unique grant opportunity, one I had never seen before. 8 years is an incredibly long time for a grant, 3 phases. I also remember thinking, that is a huge project, and that will be a huge undertaking for whatever academic partner gets this grant.
We were very innovative for the HW Endowment in the length and amount of funding that was offered to these communities. 8 years of funding with $1.5 million to each community was significant for our endowment and is significant to communities.
Well, I think that the philanthropic approach the endowment took is incredibly innovative. One, they chose to fund over an 8-year time cycle. Most grant makers give 1-year grants, if best 2 or 3-year grants, and I think this really gave groups a runway to have the opportunity to really build change. It often takes a few cycles of learning and improvement to really move big change, and to enable groups to have that runway, that time to really build that out.
It was an incredible opportunity with this grant to be able to enter the realm of improving behavioral health through looking at what we thought might work and be able to explore within the community and be able to adjust through 5 years in order to really be able to make that impact without needing to do 1 year and show exactly where we went. It allowed us to be able to really explore and dive deep into the ways that we could impact mental health within Brown County.
So here I am 7 years later, and it has been a dream job and a professional experience of a lifetime.
The second way this initiative was innovative was through our capacity building supports. Through the learning community that was built with the ABH initiative, it was very unique for our endowment of providing additional resources beyond just the grant dollars that went into each community.
So a couple years ago, AHW gave us access to a resource called Catch a Fire, which gives us access that our communities don't have to pay for consultants. So we have had other members of our coalition benefit from utilizing that resource. So sometimes our community members use it for something as simple as Spanish interpretation or Spanish translation.
Our coalitions were certainly better run as the result of what we learned in the learning communities, learning how to operate together as a team and to sort of problem solve and sort of co-create a project really came out of the learning communities.
The support that we've received from our academic partner has been really valuable. Being able to work with our academic partner to further analyze our youth risk behavior survey data has allowed us to be able to communicate additional needs that youth have to our community.
It's such an amazing opportunity to have all these people from across the entire state in the same room, learning from each other, learning, we tried this in this community. Maybe, we were having this problem. What can you tell me? How can you help me? And it just allowed for a lot of cross-coalition fertilization of good ideas spreading all across the state.
I think also the ongoing training, consulting, additional support. For example, the technical assistance partner that we get access to technical assistance or TAP hours. We have worked with some incredible consultants that have helped us create strategic plans and do other things that have helped make our work more sustainable.
And the third way that this initiative was innovative was our use of an external facilitator. The external facilitator that we used had national recognition through collective impact forums and brought resources to our participants that they would not have had access to otherwise.
So in my work, I serve as senior advisor at the Collective Impact Forum, which is a global network of coalitions all over the world. They're trying to move population level or systems change. They're trying to reduce teen pregnancy by half or improve third grade reading scores by 20% for the whole community. In this case, they reached out to me because of my work with the Collective Impact Forum, and we're interested, how could we use collective impact to move behavioral health outcomes?
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
So the question is, what does it take to actually move at some level of scale enough change that you really can see that you're making a big difference in the community overall? And that takes a coalition approach. It takes more than one organization. It takes a variety of folks working together, and sometimes that's across sectors, across organizations, across all sorts of areas.
And it's a result of many programs in the community and the county of both Native and non-Native folks that have been part of this. Prior to the pandemic, in our monthly first Friday of the month meetings, we were gaining a high attendance. We were averaging 25 plus people that first Friday of the month, which was awesome because there was representation from many programs and different initiatives going on, behavioral health and law enforcement, education, healthcare, you name it.
It was wonderful because we were taking all these folks that had been siloed around mental health issues and behavioral health issues and bringing them together under one room. So Health and Human Services, law enforcement was there.
And as we had these conversations and as other people started talking to other people, it just kind of grew and grew and grew. And so by the time we were in our final part of phase one, I think we were up to about 20 or 25 organizations maybe. And at this point, I think we're at least 50 or 60.
This initiative had 3 phases. The first phase was a 1-year planning phase. This was a funded phase, which was also unique for this initiative. In that planning phase, we had intensive learning community with all of our communities, as well as external facilitators and resources for a time for dedicated planning, capacity building to really create plans that would enable these communities to reach further. The second phase of the initiative was a 5-year, $1 million implementation phase for communities to implement the plans that they had created in the first year. And the final third phase of the initiative is a 2-year sustainability phase, when the communities really focus on a system change perspective for the interventions that they had studied through the implementation phase.
The way the project was set up in 3 phases over 8 years has allowed us the time and the space to do our work and do it well in the community.
It's not just a grant. It really is a unique and innovative philanthropic partnership that, boy, I can tell you, most groups I talk to around the country, when I tell them about this type of thing, they wish their funders did this.
After the HW Endowment's $1.5 million in 8 years commitment into each of these communities, our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
Our community learned about the results-based accountability framework during this project. And since then, we have utilized that framework in our community health improvement process, which has fundamentally changed how we do our public health, community health improvement plan, which has been awesome for our community, and it's the first year that we got to do that.
So we've learned a lot about what it takes to do this kind of work, what it takes to implement systems change. It's hard work, it's messy work, it takes a lot of relationship building. But also, we've learned a lot about what still needs to be done.
A lot of the relationships that we've made, when this grant ends, will continue, and we all have a passion for helping kids, helping youth, helping our communities be healthy with their mental health. And when this grant ends, I think those relationships will continue.
To have already 8 years under our belt and doing this work at a time that the rest of the country is tuning in, that this is a major challenge, we're really onto something that I think is going to be really helpful to the country.